We designed the SURPASS Switch trial to address a common clinical scenario that occurs. And this is a scenario where someone comes in at a lower dose of incretin-based therapy who has type 2 diabetes and an A1C level of 7% or above, usually above our target goals for diabetes control. And at that point, the clinician needs to decide whether they should continue to increase the current medication to the maximum dose, or whether they should consider switching to a more potent incretin-based therapy. In the SURPASS Switch study, we recruited 282 patients with type 2 diabetes and an A1C level 7% or above. And they all had been on Dulaglutide 0.75 milligrams or 1.5 milligrams once weekly for at least 6 months prior to the study. Our patients were then randomly assigned to one of two groups. One group was continuing to increase Dulaglutide to 3 milligrams and then 4.5 milligrams. The other group switched to Tirzepatide, where they were started at an initiation dose of 2.5 milligrams, and they were increased up to 15 milligrams once weekly. The study lasted 40 weeks. And at the end of the trial, we examined the difference between A1C and weight loss between the two groups. The key findings of the SURPASS Switch study after 40 weeks examined average A1C, the mean decrease in A1C, and the change in weight at the end of 40 weeks. So in the Dulaglutide arm, at the end of 40 weeks, the patients had attained an A1C reduction of 0.67%, a mean A1C of 7.1%, and a weight loss of 3.6 kilograms. In contrast, the Tirzepatide arm at the end of 40 weeks, those patients attained an A1C decrease of 1.44%, a mean A1C of 6.2%, and an average weight loss of 10.5 kilograms. So the key takeaway here is that when you switch to Tirzepatide, you have greater A1C lowering and greater weight loss than you do if you continue to escalate the Dulaglutide. Another key note to these findings is that although there were GI adverse events reported in each of the arms, they were not at an unexpected rate, and only one person discontinued therapy based on GI adverse events, only in the Tirzepatide arm. I'd really like patients to take away that they should always continue the conversation with their doctor regarding their diabetes medications. This is a rapidly evolving field where we have more and more medications available for our patients. So if they're on a medication and they're not reaching their glycemic targets, speak with your physician about considering switching to something else.